I'm Mark Stabile, and I'm the Director of the School of Public Policy and Governance at the University of Toronto. As many of you know, the negotiations for the 2014 health agreements are underway, and so at the School of Public Policy we convened a session to debate some of the issues around tax point transfers and cash transfers from the federal government to the provinces. We held a session here with 4 experts, Guy Giorno, Matthew Mendelson, Michael Smart, and Richard Simeon. If I could summarize some of the main points that came out during the session, I would focus on 5 key ones. The first was that there was general agreement that the state of fiscal imbalance across the country is important, and that actually moving in a disturbing direction, with some provinces becoming increasingly much more wealthy than others. The second, and it relates to the first, was that there was very little support among the panelists for tax point transfers as a way to solve this problem. Indeed, many pointed out that tax point transfers actually might make the problem worse, and that they would transfer taxing authority to the provinces that are richer, leaving more fiscal strain on the programs that remain of the federal government to actually undo some of the imbalances that would be created. The third was that there was general agreement that there's a role for the federal government in ensuring through these transfers that we have improved healthcare quality and efficiency, although there was little agreement on whether that really had much bite in the past and whether we could expect to see much more bite in that in the future. The fourth was we actually had a nice proposal from Michael Smart that linked the federal transfers to a specific tax. In this case, he proposed the GST, which would force provincial politicians, when they were asking the federal government for more money, to be clear that what they were really asking for is an increase in taxes at the federal level to help fund spending at the provincial level, and so that any increase would be also asking Canadians to increase their taxes. And fifth, and I think this was the real consensus, that despite strong concerns about where negotiations are going and perhaps the state of fiscal imbalance across the country, the likely outcome from these negotiations would be that we'd have a cash transfer with limited bite in terms of how we can improve healthcare that was probably in the range of 4 to 6% where we are now. If you'd like to see their presentations in more detail, I invite you to check them out on healthydebate.ca.